What's up, everybody? My name is Brandon Joda, and the topic I'm going to be discussing is, should physician-assisted suicide be legal? And I'm taking the con on the issue. So to start off with a definition, it's important to recognize there's a difference between physician-assisted suicide, also known as PAS, which I'm going to refer to a lot through this presentation, and euthanasia. So according to Velding, Zhang, and Berg, who have their PhDs in neurology and neurosurgery and have received multiple awards, euthanasia is defined as the administration of drugs with the explicit intention of ending the patient's life at the patient's explicit request. And physician-assisted suicide is defined as the prescription or supplying of drugs with the explicit intention of enabling the patient to end his or her own life. So in other words, euthanasia is when the doctor or physician literally kills the person by pulling the trigger. And physician-assisted suicide, the final action is done by the patient themselves. So in a lot of cases, the physician might offer them pills, which the patient would take the pills themselves, or the physician might set up a lethal injection and then the patient will pull the trigger. A brief background on the topic: Washington versus Glucksberg was a very famous case involved in this. In 1997, the Supreme Court decided that PAS has no constitutionally protected right and that it is not implicit in the concept of order liberty. However, substantive due process has changed a lot since this case, and because that is important to recognize that the court may not have considered the new fundamental rights that have been recognized since. There's some things to keep in mind before we dive into this topic. Just keep in mind, history and tradition emphasized in previous cases are important to consider and bring up. Also, that courts nowadays are able to apply a broader definition of the right to be recognized. There's a deeper and growing concern for protecting dignity, personal autonomy, and privacy of individuals, and that state-by-state legislation can very much be different. So the stakeholders involved, we obviously got the patient themselves, the physicians. We also got the patient's family that's involved, and the general public, which I'll talk more about as we go into this. So the cons, reasons I am against PAS. I'm just going to list them out first, and then I'm going to go over them. The slippery slope effect of acceptance of PAS, value of life to a community degrades lives of the sick, spiritual and existential suffering, morality state, it isn't a neutral act, and traditionally the Glucksberg established method approach. So the slippery slope, it's probably one of the main reasonings why people are against PAS in the first place. If PAS is accepted, it can cause an involuntary acceptance of euthanasia and possibly other things, such as just generally suicide looked to as just very acceptable in society. So William G. Cosmel on the slippery slope. Cosmel is a cardiologist in Media, Pennsylvania. He's been in practice for more than 20 years and has received honors and published a great amount of books and articles. And when he's talking about the slippery slope effect of PAS, he gives some Netherlands statistics, because PAS has been long been legal in the Netherlands, and in 2015 hundreds of persons were put to death without their express consent or because of psychiatric illness, dementia, or just old age. So basically he gives instances where PAS is legal in a country and people are getting put to death without express consent because of that. There's also a value of life to a community that he talks about. He quotes, "Human life has intrinsic worth and dignity, and that its value extends beyond the individual to the community." Meaning, even if the individual gives up, their life still holds a value to the general people. David Elliott on PAS. So David Elliott has a PhD in moral theology and has worked on many ethical and social issues as an ethics analyst. And his view on PAS is that it degrades the lives of the sick, disabled, and dying patients. The way he responds to this, or goes along with this, is that it creates a subclass of persons whose lives are in some sense objectively the sort of lives that one should reasonably want to end. Meaning, if you're sick and you're disabled and you're dying, people will think that ending the life is just what you should do, like automatically, and that it would just be very too accepted that if you're in some sort of state, you should just kill yourself. There's also spiritual and existential suffering that is involved. The pro side argues that physical and mental pain the patient could be going through, which is why many think PAS outweighs or is acceptable to the patient. This is what the pro argues, but many people might not think that there's actually other types of pain involved. And so Christians believe that death should be approached with humility and repentance, meaning you should feel the pain as you go through death, because if it's tampered with, it could cause spiritual pain and suffering after death. I didn't want to touch too much on this particular reasoning because I know not everybody is religious or has these kind of views, but it is also good to bring up because it is an opinion and people should be able to voice their opinions, although it might be a little bit more biased. Furthermore, if PAS was legal, medicine could potentially be seen as some kind of idol and physicians as masters of life or death. It could also take away from the importance of social investment in medical care for the dying. And there's also the question of morality. Is it moral? The moral ethics are concerning because it's not a neutral act. It's still a voluntary decision between the physician and patient. The patient's desire or request doesn't change the moral act of the patient or the physician. There's also something called the Hippocratic anxiety that may arise if we don't recognize this morality issue, which from that, the Hippocratic anxiety just means it's like when medicine as a craft will start to be subverted if our definition of healing starts to include dying. So it's pretty much saying that medicine will become like an overwhelming sort of idol, and that death may be more acceptable in medical kinds of practices. And then to end, I just wanted to mention the Glucksberg established method approach because that is what ruled PAS to be illegal in the beginning case, so I thought I should mention that as a reason why it should be illegal now. And the approach pretty much is an enumerated fundamental right will be recognized only if it can be said to be deeply rooted in this nation's history and tradition, which it is not. And some possible solutions to the problem. You could urge caregivers to recognize their responsibility to foster such important moral and life values, thereby providing a bunch of positive alternatives to PAS. And going along with that, Massey and Mueller have a 12-step plan that they are in process of, and what the plan is supposed to do is help physicians and patients look at all possible alternatives first, hence to leave PAS as a last resort or just completely not at all. And they're both medical doctors, published authors, and are approved by the ACP Board of Regents. So to completely end, the best possible solution at this point is just to provide as much alternatives possible before going straight to that resort. Thank you, and this is why physician-assisted suicide should be illegal.